Hello everyone, today we will talk about asthma, pathophysiology of asthma, and the medication to treat the asthma. So first we all should know about what is asthma. So asthma is a chronic inflammatory disease of the airway characterized by episodes of acute bronchoconstriction that cause shortness of breath, cough, chest tightness, wheezing, and rapid respiration. Now we have to take a look toward the pathophysiology of asthma. Whenever an allergen, any pollen is going to enter the body, or you can say exposure to trigger happens, your immune system is going to get activated, as you can see in the flow chart. When immune system activate, the B lymphocytes produce the IgE antibodies. The antigen that enter into your body is going to attach with this IgE antibody, and this IgE antibody then attach with the mast cell and activate it. When mast cell activation happen, they will release different types of mediators like histamines, leukotriene, and prostaglandins, and they will do their function. Histamine can cause airway inflammation, and leukotrienes go and bind with the receptor known as cis leukotrienes receptors and cause bronchoconstriction. Due to the inflammation and the bronchoconstriction, mucus secretion increases, airway edema happens, and narrowing of airways happen. Now we have to take a look toward the treatment of asthma. As we all know about the pathophysiology, now according to the pathophysiology, we have to check the treatment. The first step, the antigen bind with the antibody. We can stop this, the combination of antigen and antibody, by giving omalizumab drug. If this happen, then the second thing is the mast cell activation. So we have to stop that one. For that one, we can give mast cell stabilizer, so they will not allow it to release the leukotrienes, histamine, and the prostaglandins. We can stop the leukotriene synthesis. So for that one, we have to give leukotriene synthesis inhibitors, and that are corticosteroids. The next one are the leukotriene receptor antagonists like zapirleucos and montelukos. So they will not allow the binding of leukotrienes with the receptor. And at the last, bronchodilators like salbutamol, ipratropium, theophylline. Now we will discuss the details of the drugs in the next video. Thank you.